HarperCollins presents SAS Survival Guide, Health, by John Lofty Wiseman, read by Colin Mace.
Health. Take precautions to avoid illness and injury, but make sure that in the event medical problems do arise, everyone in the group knows first aid. If there is no hope of expert help, the survivor may have to take drastic measures to save a life. Some of the advice given in this section is intended only for such circumstances. First aid. Priorities. Where there are many casualties, treat those with multiple injuries, bleeding, breathing, and heart trouble first. Assess injuries and handle in this sequence. 1. Restore and maintain breathing and heartbeat. 2. Stop bleeding. 3. Protect wounds and burns. 4. Immobilize fractures. 5. Treat shock. Safety alert. The possibility of AIDS infection demands care in dealing with blood and wounds. Cover your hands with gloves or plastic bags. Reducing danger. Before approaching a casualty, check for danger from falling debris, gas, traffic, etc. Switch current off before touching electrocution victims. If possible, examine the patient before moving, but if there is a danger, move the patient to safety. Those with spinal injuries are at risk when moved. Unconscious casualties. Check whether they are breathing and begin artificial respiration immediately if necessary. Check for external bleeding and injury. Establish cause of unconsciousness. Unconscious but breathing. Check there is no spinal injury. Clear obstructions in the mouth, deal with any serious bleeding and place them in the recovery position. Turn the patient on one side by grasping clothing at the hip. Loosen tight clothing. Move arm and leg on one side outwards to stop the patient lying flat. Bend the elbow and knee. Turn the head in the same direction. Lay other arm along the other side of the patient. Allow other leg to bend slightly to produce a stable position. Check the airway is clear. Tip for survival. Do not place a casualty with a suspected spinal injury in the recovery position. Use an artificial airway, if available, to maintain respiration. Breathing and pulse. Loud breathing, froth around the nose or lips, blueness of lips and ears all indicate difficulty breathing. Check breathing regularly. Listen near the nose and mouth. Remove obstructions. If breathing stops, give artificial respiration. Check at the neck or the wrist for pulse. Cessation of breathing. This dire emergency may be caused by choking or blockage of the air passages, drowning or electric shock, inhalation of smoke, gases or flame, lack of oxygen, compression of the chest. Choking and blockages. If breathing has stopped, remove any obstruction in the airway. Sweep mouth with a finger and ensure the tongue has not fallen back. Give artificial respiration. If a person can inhale and cough, encourage them to cough out the blockage. If they cannot clear the airway, use the Heimlich maneuver with adults.
Sample complete. Ready to continue?